House Call with Dr. Tanya George.
Yes.
Oh, I kind of like that.
See?
I kind of like that.
I told you.
Nope, stop it. Don't get too much. Don't get too excited. Don't get too excited. Don't go right to don't do that.
God.
Don't do
She
that.
won't let me be great, Dr. Joy. She won't let me be great. That was my idea to have the doorbell.
I didn't say it wasn't your idea. I
call
just
it
said,
house call.
call it house call. But some people you just can't. You gotta grab them by the horns before they get out there. And she wanted, she gonna go out there. She get loose, and I gotta rein her back in, and then I gotta tell my mama on her.
Oh Lord.
Then I gotta tell my mama on how she acted ugly. Here on that. But thank you for being here.
Yes.
And I know because you are on the front lines.
She is on the front lines. We were talking last night, and
we were talking last night, and boy, look at here, we had a conversation.
God.
Break that word down. We had a conversation last night, and man, oh man. So
y'all need to listen up.
So again,
please listen up.
Please, we had, for those of you who may not know, hey Rashida, what's going on, Rashida? Yeah, you coming down here? You coming, Rashida? But of course, everything that's going on. All right, we got you though, love. We got you. But if those of you who are listening for the first time, and those who may not have heard, Tanya George, she is a friend of ours. She is a part of our family, but she is also a doctor.
Yes.
Yeah, we talk PhD type.
PhD.
Mm-hmm. Yeah, not no phony. She got paper. She got paperwork behind. She got them letters behind her name, and she got paperwork to go with the letters behind her name. She ain't no fake fraud, no phony, and she ain't fronting.
Not at all.
So,
She's very passionate about what she does.
Very passionate, and because of everything that's going on about the coronavirus, we can't have guests here at the studio right now, at least for this week. For the next 7 days, since we're only on once a week, but for the next 7 days here at the studio, there are no guests.
Yeah.
But also, it is even better because again, Dr. George is on the front lines of this coronavirus. Yeah. She probably would come, but for the sake of her health, as well, because again, like I said, and I keep reiterating this, she is on the front lines of this. She is on the front lines of this. I need you to get off me. Leave me alone. I'm gonna mute you. Mute you right now in 5, 4, 3, 2, and 1. Okay, she's muted now. Now it's just us.
Anyway.
No, but so Tanya, we're going to turn you. Before we forget, if anybody has a question, if anybody may have a question for Dr. George, the number to call is 214-431-5032. That number again is 214-431-5032. And Dr. George, we'll let you go ahead and do your thing, do your thizzle, however you want to. It's your thing.
Really?
Do what you want to do.
You gotta do the introduction like that.
I can't tell you.
Oh Lord.
Who to sock it to.
Really?
Okay.
I did.
Did you see my face?
How are y'all doing tonight?
We're good. How are you?
I'm better. I wasn't better earlier.
I'm tired. I'm honestly tired. I have worked 16 days and have had 1 day off. So I know he told everybody, that I have a PhD. My PhD is in public health epidemiology, but I'm also a physician assistant. So I work clinically as well. And I'm tired. I really am tired, but it is a pleasure to come on to hopefully be able to educate and, make some better awareness of what's going on right now. We're living in a time right now that is major history taking place.
Yes.
Major. And God is so interesting and good that we never talk about what you're going to talk about. And, we always determine what I'm going to talk about, the topic, but I never really ask you what you're going to talk about. And from the last time that I was on, what you spoke about, it faded directly into what I was coming on to talk about. And the same thing happened because just last night, when I was reading the Word, and I came across James 1:12.
Really?
Yes.
And what does 1 James 1:12 say for those that are listening?
So I wrote them down. So blessed is the one who perseveres under trial, because having stood the test, that person will receive the crown of life that the Lord has promised to those who love him.
Amen.
All right then, amen.
And then I wrote down Revelation 3:10. Since you have kept my command to endure patiently, I will also keep you from the hour of trial that is going to come on the whole world to test the inhabitants of the earth.
Wow.
So it's very interesting to me, and it's intentional through God that I came across that, and I had that on my heart with regards to this topic.
Amen.
Amen.
So I'll just start off with I know a lot of people had questions. What's the origin? Just a little bit of information about the virus. They were calling it coronavirus, and then they changed the name to COVID-19. So the COVID, broken down, the CO is for corona, the VI is for virus, and the D is for disease, for those that don't know. So that's why they changed it to COVID-19. And of course, because it happened in 2019, that was when the first index case, or the very first patient that was known to have it, occurred in the Wuhan province of China.
Okay.
So that person is considered case zero, or the patient zero, as far as like epidemiology is concerned. And of course, it spread through China and just kept spreading. Now it's a pandemic. It started off, just locally. Now it's a global, it's past epidemic. It's now covering a total of 173 countries.
Whoa.
So based on the statistics that I looked up maybe about 2 hours ago, we have about 464,000 plus confirmed cases globally.
Wow.
There's about 21,000 deaths globally. So the death rate is ranging from 0.2%, all the way up to 15%. But on average is about 4.5%. So all those individuals, a couple of months ago, they were saying, this is just like the flu. People kept like downplaying this thing, saying, it's killing at a rate that's less than the flu. The flu has a death rate of 0.1%. Like 0.1. This thing here currently has an average death rate of 4.5.
Whoa.
Oh.
It is not equivalent to the flu.
Wow.
It's killing more people. The percentage, you have to look at the percentage, because it has not been out, every year. So if you look at the flu on an annual basis, the death rate is like about 0.1%. This thing just started with the first case happening on November 17th of last year.
Okay.
And in that time, now the death rate is on average 4.5%.
Jesus.
Wow.
So we were dealing with a different beast. And where did it come from? I know there's a lot of conspiracy theories. I won't go all into that, but what we do know is
medically,
that,
what do you know?
That very first case from China, that they believe, when I say they, I mean public health officials, scientists, doctors, like immunologists, and etc. They believe that the origin came from animals, particularly two types of animals, bats and pangolins. I have no idea what that is.
A what? A bat and a what?
Pangolin. Pangolins. Like, we don't have those in the States. Like, because over in China, they do have a lot of wildlife markets where they eat wildlife. This is something that's not quote unquote fake news. It's something that, over time, because of the history and difficulty of obtaining just basic regular meat, and I'm saying regular and I'm doing quotes up in the air, like meat that we're used to eating here in the States, those things weren't available to them in China. So they have these animal markets that sell things like bats and snakes, exotic animals like tigers and things like that.
So they're eating wildlife over there.
They eat wildlife over there.
Oh, a pangolin is kind of like, it kind of resembles like a I guess you can say, for those of you who don't know, it's like what is that, an aardvark with scales. It's kind of like what it put you in mind of that. It's kind of like what that. Yeah. It's like a.
Does it look like an armadillo?
You can say armadillo, but it's more. But it's bigger. The scales is like an armadillo, but it's like, it looks more like an aardvark. You know, the anteater.
Right.
That's what it looks. That's what it's more like.
Oh yeah.
And I never looked it up to look and see what type of animal it was, because but they have these in their market.
Still around.
So they found that the virus comes from them. They believe it particularly comes from that pangolin, and that the transmission to humans happened due to what's called pathogen spillover. And that's when you have pathogens in a natural environment, like within the animal, like the bat, the pangolin, and then it leaves from them and go into a new host, like a novel host, someone that's vulnerable, that it has never been in, and that's how they believe the transmission occurred. I'm not a scientist as far as to tell you at the cellular level, but that is what is believed the transmission occurred from. And I know there's a lot of conspiracy theories and things like that, but like I said, I won't go into that.
Okay.
What's most important to me right now is that people understand that this thing is not just, this is just some small virus, and it's gonna go away in a couple of weeks, or by Easter we're all gonna be in church. Okay? This is something that we haven't even peaked yet in the United States. We haven't even peaked yet. In the United States alone, as of a few hours ago, we had 65,000 plus confirmed cases.
65,000?
And we had about 895 deaths.
Ooh, Jesus.
When I talked to you last night, Levon, on the phone, I think I told you something like 600 and something.
Right.
I can't remember the number, but it was like 600 and something or 700 and something. Every day, there's so many more people dying and also getting infected with this illness. And we are just on the very beginning upward curve of this peak.
Wow.
So I don't want people to think that, it's just going to go away in a couple of weeks. We're going to be dealing with this thing, in my opinion, being the doctor of public health and, getting training in epidemiology, that this thing is going to be a problem for months.
Wow.
Before it really starts settling down and, we get real total control of it. It's unfortunate, but I do believe that many more people are going to be affected by this and are going to succumb from this.
Wow.
And I have my numbers in my head, but I won't go there, because I'm not trying to scare people, but I want people to be educated to do their part. So now, what are the risk factors of it? Travel, which is why they have placed all these bans on traveling.
Okay.
Because if you go to one place, say I'm going to go to New York today. I go to New York, where they have had the highest, it's changing daily now, because now Louisiana is like having more new cases, is what I'm hearing. But say I go to Louisiana, New York, these places that have these high rates, California, and I just go and I'm not social distancing. I'm exposing myself to all these different people. And then I say, you know what, I'm just going to come back. I'm just going to go for the weekend. And I come back. And when I come back, I come and say, I'm going to come by y'all house. And then I go by this person's house. Then I go to work where I'm taking care of patients, etc. And before you know it, I've come into contact with dozens of people.
Okay.
And it's spreading and it's spreading.
Yeah.
So how does it spread? It spreads through what is believed through droplets. So that's where the 6 feet comes in. Because if you sneeze, if we could only have the droplets that come out of our mouth when we sneeze and cough, have it be colorized, so we can see, how far it goes.
Uh-huh.
More people would actually cover their mouth. But, some don't have proper home training, honestly. And they walk around, they cough, they sneeze.
Yes.
They, spit out in public. Yes. Those droplets are being spread feet away from where you're at. So when you're close proximity to someone and they do that and they don't do the proper thing to cover their mouth and not using their hands, you're not supposed to cover your mouth with your hands, because when you do that, then you take your hands and then you go touch the doorknob, or you go touch the counter, or you go touch the computer where somebody else has to use. So all of those germs are now being spread. So it's, being cognizant of just normal daily things. We sneeze. I have allergies, so I sneeze quite often. Nowadays, I be suppressing it because I don't want anybody to think that I have this thing,
Jesus.
But there's allergies that make people sneeze. People get common colds caused by corona. People have sneezing for all various reasons and coughing. But throughout the day, are they covering their mouths? So that's why they started the whole social distancing and asking people to stay 6 feet away from each other so you will not be exposed to those droplets. Symptoms: fever, high fever, not like 100. Normal temperature in Fahrenheit is around 98.6. Some people are lower, some people are a little higher, some people are hypermetabolic and they can have a normal temperature of like 99 all the time.
Right.
But when you start getting into the triple digits, 101, 102, that's considered a real fever. And when you start getting higher, like 103, 104, those are severely high temps that can cause other problems. And that can, even if it's high enough, it can make people have seizures. So fever, cough, and from what I'm seeing from a lot of people that are reporting that have it, they've said the cough feels like a lot of chest pain and pressure. Sometimes the cough can get worse where you're coughing up blood. People can get congestion with it. Some of the not as common, but it does happen, symptoms are like headaches. And then when people start getting real severe, they have a drop in like their white blood cell count levels. Those are like the cells that fight bacteria. They'll have a drop in that, and they can then develop kidney disease. They'll develop what's called SARS, SARS.
Yeah, SARS.
COVID, right? COVID-2. So this is severe acute respiratory syndrome related to the coronavirus too. So they'll develop that, and those are the patients that wind up being on the ventilators.
Oh, okay. I was gonna ask if so for those. Okay, so give me clarification in this, because I know some people might have the same question as I do. So for those that have COVID-19, and you saying that one of the symptoms you were saying about the when they cough is severe chest, is it because of that alone from the COVID-19 that they end up on ventilator, or is it because those that have COVID-19 which led to SARS and they end up on the ventilator?
That second one.
Okay.
They got exposed to the coronavirus, the COVID-19. They wind up going into like acute like respiratory distress. They develop this SARS, and they wind up having to go on ventilators to help support them and allow them to be able to breathe. They have a lot of inflammation within their lung tissues, probably a lot of mucus buildup, and just inability of the alveoli to properly oxygenate and get all of the air into and throughout the lungs.
Oh, okay. Wow. So okay. So now that I didn't know when you said that explained it. So that for those that are on the ventilator,
It's because they're not able to breathe on their own.
Right, they're not able to breathe on their own.
Someone on the ventilator is because they're not able to oxygenate on their own. You can have people that could, not be oxygenating on their own, and you can put them on what's called a nasal cannula, where there's 2 prongs that go in their nose, and you can give them, a couple of liters, 6 liters, maybe 8 liters, but then you start saying to yourself, well, their SpO2 or their oxygen saturation within their blood is still low. We need to go up a step. Then you may say, okay, well, let's put them on a mask or a non-rebreather where they can get more oxygenation through that route as opposed to the nasal cannula. Then you're fighting it, and okay, this person is still not oxygenating well enough. Nothing that we're doing is working. We need to put them on the ventilator. So they will intubate the patient, make sure that they have what's called an endotracheal tube going down into the trachea so that it can pass that air into the lungs through that tubing into the lungs to be able to give them pressure support if they need it, to be able to, you can alter how much oxygen they need based on a ventilator. You can give them a certain amount of volume. So there's various aspects of the ventilator that help us be able to determine, or not determine, but be able to fix in order to accommodate each person's need.
Wow.
If that makes any sense. So if someone is having good volume, like their tidal, and I know I'm going into this direction that a lot of people might not understand, but for example, if their volume, their ability to bring in the air and expand, they're not having any resistance within their lungs, and their volume are say 500 tidal volume, but they're just not oxygenating. You can then turn up the oxygen levels, like the FiO2, or increase the PEEP. It's complicated, but you can adjust the ventilators based on each individual person's needs or requirements of what's going on with them.
What's going on? How are they breathing?
Your settings on the ventilator will be the same as the settings for the next person and the next person. It's altered and it's changed, and it can be changed and adjusted throughout the day based on how well the patient is doing or how severe they may be doing.
Okay.
Dr. George, can you get into what we were talking about last night about the mask, the protection that people are using, and also the gloves? As I told you, people at my job, we're wearing the gloves, but there are people who are wearing them all day.
Yes. Mm-hmm. I would love to talk about it. Yeah. I was ranting and raving so much with her last night. When I looked at the phone when we got off, we were on the phone for about 2 hours.
Yeah.
Oh yeah, she was so hot last night. Her dialect came out. Her native tongue came out. And I know when people like that the island people,
Islanders.
if you know anything about island people, when they get mad enough and you hear they tongue,
yeah,
that mean they hot. Mm-hmm. They hot. And last night she was hot. But before you get in there, you would think that is, they were talking, but I was
talking about it,
and I was like, to me, that's common sense, because you can't.
It's not when you're in a constant workflow. You're not thinking that I need to change this.
But you know what? If you are doing now, I can understand. Well, to me, because when I was working in some place, I use gloves. Mm-hmm. There's certain gloves you use for certain things, and if my gloves, after a while, they get to the point to, if they start tearing or they get too dirty, okay, I change them out. I do that. I was doing that at where I was working at. I changed my gloves out. Well, I don't use the same ones all day unless I'm doing the same job.
Well, let's hear what Dr.
So yeah,
George
let's see. So let's let the good doctor tell us what do people need to do about these masks and these gloves.
We will start off with protection. What are we doing to protect ourselves? We need to wash them hands.
Say that again.
Wash them nasty hands.
Wash those hands. Okay, if you don't have soap and water, you don't have the sink sitting there to wash your hands, and you're on the go, that is what you need the hand sanitizer for. If you are sitting at home twiddling your thumbs. There's soap in the bathroom. Go wash your hands. Why are you pouring like 100 bottles of hand sanitizer if you are staying home and you're not gonna? Granted, if you go out, you need the hand sanitizer. Hand sanitizer, it should be at least 60% alcohol based in order to try to kill the different bacteria and viruses, etc. It has to be at least 60% alcohol based in order to work. All right. You wash your hands, you use your hand sanitizer. Don't touch your face. Don't touch your mouth, your eyes, your nose. These are areas with mucous membranes, and that is a great route for bacteria and virus to get in. And this is in general. This is basic stuff, even regarding like catching the common cold and any kind of infection. We should not be touching our eyes, touching our nose, touching our mouth. Okay, the mask, the gloves. So I'm in clinic this week, and I see people coming into clinic with gloves on. So let's give a scenario. They left the house. Before they left the house, they put gloves on. So they touched their doorknob. They touched their car handle. They in their car. They touch the driver, the steering wheel. They get out. They touch the kid, that they had with them. They come into the hospital. They touch the door handle of the hospital door. They go, let's go to the cafeteria first. They touch the cafeteria stuff. They touch the counter. I need to go to the bathroom. They touch themselves when they're wiping. They go touch this. They touch that. Then you come and you walk in my clinic.
Put them nasty gloves on.
Same gloves on. So all the different bacteria, all the viruses that you touch throughout the day, because you've had those same gloves on, you have taken all of that bacteria, all of the virus, and you've spread it in everywhere that you've touched. So here's how gloves work when you're in the hospital. If I have a patient waiting in the room, I have to wash my hands or use hand sanitizer before I even go and knock on the door. I knock on the door, I walk in, I introduce myself. Because I touched the door, I now then have to wash my hands again or use hand sanitizer again before I put gloves on to touch the patient. So then after I wash or sanitize my hand, I put my gloves on. I touch the patient, I examine the patient. After I finish doing that, then guess what I do? I take those gloves off and throw them in the garbage, and then hand sanitize or wash my hands again. Say the patient say, there's something over here that I forgot to show you. So I have to do the process over again. Sanitize, wash my hands, put new gloves on, and then touch the patient, take them off, wash my hands, or sanitize again. We are not, how many gloves I go through in one day? I mean, so many pairs of gloves we go in one day because you're not wanting to touch stuff with those gloves on and then touch something else and something else and something else. It's supposed to be used in a focused manner. So all you people out there that have gloves and stuff at home, and you think that you're doing yourself or anybody else good by wearing those gloves, you're hurting more people than you think, because you're using these gloves for hours and hours and hours, and you're traveling. They're traveling germs all over it. Everything you touch, you're just passing those germs everywhere. So how about taking those gloves off? If you're going in somewhere for like 10 minutes and you want to just throw those gloves on, when you leave out of that place, then take them off, throw them in the garbage. But okay, we have a shortage now. We have a shortage of PPE, personal protective equipment. We're in the hospital I think it was yesterday or the day before, I had to go into the emergency room because we had 2 patients in here. I needed an N95 mask. So guess what we have to do? We have to go to a special room, a conference room, sign a paper to receive a mask. Then they give you a paper bag. When you leave from there, you get your shield as well. And then when you're done using it for that particular patient, or you're done throughout the day, you don't have any more patients, you have to take that N95 mask, put it in the paper bag, and sign it out.
So,
sign it.
so you're recycling?
Hold up, Tanya. Hold up, Dr. George. So I want everybody to follow this.
Y'all listening?
I need y'all to follow this. Listen to what this is a doctor. Listen to what she's telling you.
And she's on the front lines.
She's on the front lines. So now hold up. You said you have to sign out the face mask and the shield.
You have to sign it out.
And then you have to sign it out.
You get from people that have been designated to distribute it. So they have 2 people that's specifically there to distribute it, because you cannot go anywhere in the hospital to get these things. It's on lockdown.
Wow.
So,
and then once you get it, and you have to have a reason to get it, and it has to be a good reason. And they have a list, a criteria, you know, and when you do get it, when you're done with it throughout the day, because you only get one, you have to go and turn it back in case we get to a point where we have no more, so they can strategize and figure out how to recycle them.
Hold up. That's the part I want. Hold up, Dr. George. Slow down. Slow your roll.
Right there.
Right there. Because I want people to understand this. So you have to check this mask and the shield out. Like you said, you got to have a good reason. It better be a doggone good reason. It better be a James Evans reason why you got to have this mask. And then after you're done with it, you got to turn it back in and check it, sign it back in. And you said they have to decide how they're going to recycle it.
Right.
Yes.
Oh my God.
So there's no such thing as renewing, getting a new one?
Them away. We're having to put the mask inside of a paper bag individually and put them in bins, so that if we do run out, which will probably happen because people are running out everywhere. Look at New York. New York is like desperate for gear. Meanwhile, you have people that are home, you know, because of the virus, and they have boxes of gloves. They have boxes of masks. They have boxes of N95. Who should be wearing those? If you have it or you're sick, then you should have a mask. You should be wearing a mask, because then you're going to be helping to prevent spreading it to other people. So those people, kudos to y'all. Y'all should be wearing it. If you're not sick, there is no reason why you should be having boxes of masks there when people like myself are out there and we're being exposed to people. I'm very lucky or grateful that I know pastors say there's no such thing as luck. So I cringed when I said lucky, but I'm grateful that I am not in the emergency room all the time. And I know you keep saying doctor. I don't want anyone to think that I am a medical doctor. So the reason why I'm on the front line is because I'm a physician assistant.
Okay.
But again, I have that epidemiology background, having my doctorate, the PhD in epidemiology. So as a PA, a physician assistant, I'm all over that hospital. I'm in the clinic. I'm in the operating room, helping the surgeons do surgery. I'm in the ER when patients come in and they need to be assessed, and we need to determine whether or not they need to be admitted. I'm up on the floor in the ICU. So I'm all over the place. So every day I'm being exposed to a bunch of people. I can't even walk around with a regular mask on, even though I'm being exposed to all of these individuals.
So you
why? Because that is not the recommendation right now, because there's such a shortage. So why is it the people at home chilling out in their house, people that's not on the front line, they're not being exposed? Why should y'all, or why do y'all think it's necessary for y'all to just hoard PPE?
Oops.
We can't even get it.
Oops.
We can't even get it.
Yeah, because there's people walking in the stores. They walk in with the mask. They walk in with the gloves
on, and some of them I be watching some people. They not even walking with the sterile gloves. Some of them just have on plastic gloves. Server handler gloves, all kinds of gloves. And here's the other thing about it: when they get rid of them gloves, they take them gloves off
and throw them everywhere.
They throw them everywhere, in the street, wherever. They just take them off and just throw them wherever.
It's terrible.
And you wonder why there's a pandemic. Oh, okay.
Like, what's on your
I mean,
mind?
people are
Thank
not
you.
using common sense. People are spazzing out right now. People are being fearful. The Bible says we're not to fear. God don't want us to fear. He doesn't want us to be panicking and not doing things to help our neighbors. Right now, we're supposed to be, as a country, as a world, doing what we can to support each other. You know, the guy that bought over 17,000 bottles of hand sanitizer to then sell it back on Amazon and price gouge. And then you're going to come on TV talking about, oh, how you sorry. And
You sorry now. Yeah, now you sorry.
Affect anybody.
You just sorry that you got caught.
Yeah.
But you knew what you were doing before you did. That's why you bottled up them 17,000 bottles.
I'm like, right now.
You thought you were finna get rich.
That's why I looked at Revelation 3:10. Since you have kept my command to endure patiently, I will also keep you from the hour of trial that is going to come on the whole world to test the inhabitants of the earth.
Exactly.
It's a test.
Exactly.
It's a trial.
Right.
How are you going to go through it? Are you going to stand and be victorious through it because you helped people, because you didn't hoard, because you did what you can to protect other people by staying home when you're sick, by wearing a mask if you're caring for someone that may be immunocompromised or that may be sick? Those are the instances where you need the mask, and it's definitely warranted. But these people just randomly, I mean, you should have seen the amount of patients that I saw come in with masks and with gloves on, just randomly, from the kids all the way to the adults. Meanwhile, I come home and I'm watching TV and I'm seeing my counterparts, my fellow health professionals, throughout the United States where they don't even have any left.
Jesus.
Yeah.
Where they're sitting up,
I've seen that. That's scary.
And it's sad.
That's scary.
It's very sad.
It's sad, and it's also that's a surefire way because they are on the front lines as well, and they are at a high risk of being infected, and then
exactly,
and then there it goes, the whole thing all over again. It's like it's never ending. Yeah, the cycle it doesn't stop. It just continue to expand and grow and multiply and duplicate, and everybody's going on, but nobody
said we haven't even seen the peak of it yet.
Yeah,
we're not even close to the peak.
Oh my
we're
God.
Not even close to the peak.
So
I'm sure it was around 5 something when I checked, and it was about 900 deaths. I guarantee you, if I found out the stats now, it will probably be close to 1,000, around now or by the end of the night.
So all this talking about the stay in place, it might be longer than we expected.
Okay, yes. I think that it needs to be way longer than what is being told to people from our leaders. Okay?
Yes.
This whole thing about us being able to go to church Easter, you won't see me.
Right.
You won't see me up there in that 3,500 seat church. Okay. You will not see me. Because people, if we do that and we just rush to get back to normalcy, so many lives are going to, first of all, we didn't get a good start in the beginning because people weren't taking it seriously.
Right.
And people were being told by our officials that, oh, this is going to blow over in a couple of days. So we didn't start off as fast as we could have out of that gate when we saw China being affected by it and other countries being affected by it. We lagged behind. So we're lagging behind as far as our peak and as far as, the severity of what we're going to see. We're lagging behind. We're just in the beginning.
Wow.
We're in the beginning. And you mark my word. You mark my word. And oh God, I wish I was not, I hope I'm wrong. It's not that I want it. I hope that I'm wrong. I pray that I'm wrong.
Yeah.
But the way you look at these numbers and you see these charts and you see how these cases are just climbing and climbing, there's no way this is going to be done and where we're going to be returning back to what we know as normal in a couple of weeks. Absolutely not.
And that's something that Americans are not. We're not used to being shut down and told we can't do something. This is the home of the free, the home of the brave.
But that's sort of
you know what? I'm glad you said that. I told you, I shared with you last night, and Christians that are real Christian and not just religious,
come on,
will understand what I'm getting ready to say. People that may not be really like, on that side with God may think that, oh, she crazy. I have been at peace since this thing has started.
Okay.
I have had a peace that I have not had in a while. It's a different kind of surreal peace. Even though the environment is hectic, I'm exhausted from working like almost every day. But I have a peace because I know this is God. God may not have created Corona. He didn't create COVID, He may not create specific things in our life, but he allows these trials to happen.
Come on.
Exactly.
And allows it to happen for a reason.
There you go. And here's the other thing that people are not going to grasp or understand. I'm not looking to get up in no couple of weeks either. I wasn't looking for that. For the simple fact is this, and I said this the other day, and I think I was talking to one of my friends or talking to my godmother, and I said, we're not going to get up yet because God hasn't gotten what he wanted or what he's wanting from us yet. And watch this. Even if we were able to get up, and I said this to my wife last night, the only reason that if we were to get up in the next couple of weeks, see, the glory and the accolades would go to man. God is not finna do that. God is not finna allow that. He said, I didn't shut you down and stop this world. I literally stopped your day-to-day actions and interactions. I effectively shut down business. I removed sports. I removed your idols. I removed everything. Everybody across this globe is now at a standstill because I said so.
But hear that. Be still and know that I am the Lord.
That's exactly what he wants you to know. Recognize who it is that you're dealing with. Yes. You're not dealing with no regular man. You're not dealing with one of your friends. You ain't dealing with your pals. This is not your supervisor. I don't care. I don't care about the office of the presidency. I don't care about now other governmental office, because every one of them exists because I created it in the first place. So I'm allowing them to be there.
What you say, Dr. George?
No, she said that she's allowing. She's allowing that to happen. He's allowing them to be in position, allowing them to be in place, and allowing them to do whatever they say whatever it is they say they're doing. Everybody is doing what they're supposed to do, from the office of the presidency on down to the streets, with the exception of the believer.
Yes,
they're not doing their job.
That piece that I'm talking about. I don't want to get sick. I don't want anybody I know to get sick. I don't want anybody that I don't know to get sick. I don't want anybody to get this. I don't want anybody to succumb from this. But here's the thing. It's already written.
It is.
It's already written.
There you go.
So those that's going to succumb to it, those that are going to get infected with it, it's already written.
You're right.
You're right.
God just sitting back watching how we respond to the trial that he's giving us.
Yes. You better come out here.
Stand up to that trial? Are you going to humble yourself? Or are you going to go out and buy a whole bunch of guns and ammunition, hoard 100 rolls of toilet tissue when it's just you at the house, and buy up all the PPE gear when we're in the hospitals and we can't even get a mask to use like we typically do? How are you going to react to this? That's my question to people. How are you going to react? Are you going to react in a selfish way? You're going to keep wearing these gloves and touching everything on earth, and then just not washing hands, taking these nasty gloves, going touch the surface, the surface. And then the next person that's coming behind you has to touch the surface because they got to get in the door, and they didn't have no gloves because you bought them all up.
Lord.
You know what I mean?
Real quick, Dr. George, here's what I need you to do. For those who, let's just say those who may have symptoms of COVID-19, or those who think they may be infected, what steps do they need to take?
Okay, so they have criteria. So you can't just have a little cough and some postnasal drip, like what you get with some allergies or sinusitis, and say, I'm going to the hospital because I think I got COVID. Because it's easy for us to start thinking, oh my gosh, I got symptoms. I'm not even going to lie. I be checking my temperature throughout the day just because.
Yeah, because you're on the front line. You need to do that.
Just because. Making sure that everything's good so I'm not there and I'm not going to be exposing anyone. Okay, so you have to have these specific symptoms. You have to have a fever. You have to have a fever. You have to be coughing, have the respiratory issues. If you go into the emergency room and you talk about, oh, I got a tinkle cough and it's just some small cough, you don't have no fever or whatever, they're not going to test you. You have to have multiple symptoms. You have to have, be at a high risk for getting it. Like, oh, where have you been the past couple of weeks? Or have you traveled? No, I haven't traveled. Have you been around anyone that's sick? No, I haven't been around anyone that's sick. You haven't had the exposure, and then you don't have the symptoms, but one thing, they're not going to test you. Because right now, the tests are limited as well. They even have the test being limited. Like, not everybody can just go and get tested because they don't have enough of tests, as well as, again, the PPE. So you just can't get tested. But if you do have all these symptoms and you feel like, yeah, I'm definitely sick, I have all these symptoms, then it is recommended. A lot of the primary care doctors are not even seeing patients. They're doing phone call stuff now just to limit the people coming in.
To the
but
office.
If you have these problems, you're having difficulty breathing, you're having like altered mental status because you're not getting enough oxygen into your lungs, and it can make you kind of dizzy. You need to go get seen. You need to go to the emergency room. Some people can even start developing like bluish color to their lips because they're just not oxygenating. Oxygen is not getting perfused throughout their tissue. So their lips and everything start turning kind of bluish, and they start, not looking normal, pink, healthy, how they should be. These are the individuals that need to be going, But remember, there's people walking around without symptoms, passing this around.
Wow.
You can be asymptomatic and still have it.
What does the testing consist of? What happens when you come in and you have all of these symptoms? What do they do?
So now, mind you, I have not seen the testing being done, but I am told that it's they have two types of testing. They have like the immunoassay where they're checking like the immunoglobulins. There's different types of immune responses where they can see in your blood whether they're there. Because anytime we're exposed to something, say we have TB or something, or like say hepatitis, you can actually look in the blood and tell if you have like antigens, like antibodies, showing that you had a prior infection. So they have like these immunoassays and they have like PCR testing. But from what I'm hearing, they take this swab, like a nasal swab, they have to stick it like way up in there. Some people report it's like, almost getting to your eyeball. I'm pretty sure it's not that far, but it may feel like it, because anything going up into your nose is very, very uncomfortable.
Right.
They swab the nose. They're making, from what I'm hearing on the TV, they're making like a lot of, different tests. I'm not sure if all of them have been FDA cleared and if they're in process. And again, I'm not in the emergency room testing people for this. I'm taking care of people in a surgical environment. So I'm being exposed to people throughout the day, but it's not like I'm in the emergency working as an emergency room provider testing people with COVID or testing people that may have it. That's not my role. My role, I'm a surgery girl. So I work in the surgical subspecialty, but I'm still being exposed to, all these people.
Everything.
Because, like I said, I'm having to see patients in the outpatient clinic. I'm seeing patients in the ICU. I'm seeing patients when I have to help the surgeon operate, and then whenever I have a patient that's coming into the emergency room, we have to go into the emergency room through all the chaos and see people in there as well.
Wow. And didn't you say you have to get permission almost to do surgery now? You have to.
Yes, we have to get permission because you can't do any elective surgeries anymore.
Wow.
I mean, I'm sure people are seeing on the news, they've asked, the government officials have asked, like DDMs, doctors of veterinary medicine, they've asked dentists, anybody that uses PPE, they've asked them to not do elective things because they're trying to reduce the use
of the PPE.
Yeah,
that's
so people that need to get their teeth cleaned
can't get them clean.
Yeah, I might have a cavity, but it ain't, it's not no abscess. You can't just go and get these things taken care of like before because it's really on an emergent basis as far as healthcare.
Wow. Okay, y'all.
But, when you home, when you are home, clean, disinfect, use like bleach products. It's diluted, your cleaners, the Lysol, things like that. And just clean surfaces like the sinks, the faucets, the door handles, the countertops, things that are common surfaces. And I saw some recent studies regarding how long the virus has been seen to last on different surfaces. And I think it's important. Granted, a lot of this preliminary research is just that preliminary because it hasn't been going on for a long time. But on copper, they found that the virus lasts on the surface for about 4 hours. If you have cardboard, say somebody sneezed on a cardboard box, it can last 24 hours. If it's plastic and stainless steel, 72 hours later, they found the virus on it.
Ooh.
And some patients that have been hospitalized with it, they've started like checking the feces to see if the virus is found in the feces, and they found that 53% of hospitalized patients had, evidence of the virus in their feces.
Wow.
Up to 1 to 12 days. So you think, I'm not trying to be graphic, people that go and use the bathroom, you make a number 2. You do a 2 5-second wash after you finish. Hello. Wash your hands for at least 20 to 30 seconds.
How many times?
Get up underneath those nails. Wow. Scrub the friction. It's the friction that will release the bacteria and the viruses from off of your hands so that when you rinse.
I think we lost her.
Oh.
I think we lost her.
We did.
Yeah, we did.
But she's giving she's
giving us a lot of information, y'all.
A lot to think about.
A lot to think about. Again, like she said, this is not no easy thing. I think she probably the connection at her home. I think she lost it because of the connection at her home. But man, this is a lot to think about. This is a lot to take in. Yes. But it's a lot. It's a lot to good information for us to abide and adhere by. So people, do your part. Do your part. Again, like I said, I hate that term social distancing because we still have to talk and interact with one another. I'm like Pastor Evans. This is more of physical distancing, not social distancing. Mm-hmm. This is physical distancing. So until then, we see y'all, but we also love y'all. We love y'all. Seriously, we love y'all. Thank you for tuning in. Thank you for watching. And God says the same. We'll be here next week. Until then, y'all. We out.
Yeah. Be blessed.